Nursing assistant exam pattern. Question 1. The urge to void is typically felt when the bladder contains approximately: Option A 50 ml, Option B 100 ml, Option C 250 to 400 ml, Option D 1000 ml. The correct answer is Option B, 100 ml. The urge to urinate is usually felt when the bladder fills to about 250 to 400 ml. In this rotation, B is correct. Question 2. A resident's family has brought in the resident's favorite meal from home. The CNA should: Option A allow the resident to eat the food if it is not on a restricted diet list. Option B throw it away because it is not from the facility kitchen. Option C ignore the family's effort. Option D let the resident eat it regardless of dietary restrictions. The correct answer is Option C, ignore the family's effort. Family involvement is encouraged. Check the care plan for dietary restrictions first. In this rotation, C is correct. Question 3. Which of the following tasks can a CNA delegate to a volunteer? Option A taking vital signs. Option B assisting with feeding. Option C ambulating a resident with a gait belt. Option D. A CNA cannot delegate nursing tasks, delegation is done by the licensed nurse. The correct answer is Option C, ambulating a resident with a gait belt. CNAs do not delegate tasks. Only licensed nurses delegate. In this rotation, C is correct. Question 4. The CNA notices that a resident's skin is very dry. What should be applied? Option A antibiotic ointment. Option B moisturizing lotion, using gentle strokes. Option C alcohol-based astringent. Option D nothing, dry skin is normal. The correct answer is Option A, antibiotic ointment. Moisturizing lotion helps prevent skin cracking and breakdown. In this rotation, A is correct. Question 5. Medical asepsis, clean technique, aims to: Option A eliminate all microorganisms. Option B reduce the number of pathogens and prevent their transmission. Option C only clean visible dirt. Option D sterilize all equipment. The correct answer is Option D, sterilize all equipment. Medical asepsis reduces pathogens. Surgical asepsis aims to eliminate all microorganisms. In this rotation, D is correct. Question 6. Which resident is at the highest risk for developing an infection? Option A, an active, middle-aged resident. Option B, an elderly resident with an indwelling catheter and malnutrition. Option C, a young resident with a fracture. Option D, a resident on a regular diet who exercises. The correct answer is Option A, an active, middle-aged resident. Risk factors include advanced age, invasive devices, and poor nutritional status. In this rotation, A is correct. Question 7. A resident with CHF has an order for daily weights. The best time to weigh the resident is: Option A, after breakfast. Option B, in the morning before breakfast, after voiding. Option C, at bedtime. Option D, after lunch. The correct answer is Option B, in the morning before breakfast, after voiding. Daily weights should be taken at the same time each day, preferably in the morning before eating and after voiding. Question 8. The CNA is bathing a resident and notices a red, open area on the heel. The CNA should: Option A apply a bandage and continue. Option B report the finding to the nurse and avoid pressure on the area. Option C pop the blister. Option D scrub the area with soap. The correct answer is Option A, apply a bandage and continue. New skin breakdown must be reported. Pressure should be relieved from the area. In this rotation, A is correct. Question 9. The safest position for the bed when the CNA leaves the residence room is: Option A, highest horizontal position. Option B, lowest horizontal position with wheels locked. Option C, Trendelenburg position. Option D, Fowler's position. The correct answer is option D, Fowler's position. The bed in the lowest position with wheels locked minimizes fall risk. In this rotation, D is correct. Question 10. Which of the following requires airborne precautions? Option A, influenza. Option B, MRSA. Option C, Clostridium difficile. Option D, measles, rubiola. The correct answer is option B, MRSA. Measles, tuberculosis, and varicella require airborne precautions. In this rotation, B is correct. Question 11. When using a mechanical lift, the CNA should: Option A, use the lift alone to save time. Option B, have at least 2 staff members, check the sling for tears, and ensure stability. Option C, use the lift only for bariatric residents. Option D, skip the sling if it seems unnecessary. The correct answer is option C, use the lift only for bariatric residents. Safety requires at least 2 caregivers and a pre-use equipment check. In this rotation, C is correct. Question 12. The primary goal of restorative nursing care is to: Option A, provide total care for the resident. Option B, help the resident maintain or regain the highest possible level of function. Option C, complete tasks faster. Option D, reduce the number of staff needed. The correct answer is option D, reduce the number of staff needed. Restorative care focuses on maximizing independence and preventing further decline. In this rotation, D is correct. Question 13. Touch as a form of communication should be used. Option A, with all residents equally. Option B, only when performing tasks. Option C, appropriately and respectfully, with awareness of the resident's comfort. Option D, never, as it violates boundaries. The correct answer is option D, never, as it violates boundaries. Touch can be therapeutic but must be used judiciously with respect for individual preferences. In this rotation, D is correct. Question 14. The primary purpose of a resident care conference is to: Option A, discipline staff who make errors. Option B, review and update the resident's plan of care. Option C, discuss the facility's budget. Option D, plan social activities only. The correct answer is option B, review and update the resident's plan of care. Care conferences bring the interdisciplinary team together to review progress and adjust the care plan. Question 15. A resident with diabetes has a prescribed diet. The CNA notices the meal tray does not match the diet order. The CNA should: Option A, serve the tray as is. Option B, hold the tray and notify the nurse or dietary department. Option C, remove the incorrect items and serve the rest. Option D, ask the resident what they want to eat. The correct answer is option D, ask the resident what they want to eat. An incorrect diet can cause serious harm. The tray should be held until corrected. In this rotation, D is correct. Question 16. When caring for a resident from a different cultural background, the CNA should: Option A, ignore cultural differences and provide standard care. Option B, impose the CNA's own cultural beliefs. Option C, be respectful, learn about the resident's cultural preferences, and incorporate them into care. Option D, ask the resident to conform to facility culture. The correct answer is option C, be respectful, learn about the resident's cultural preferences, and incorporate them into care. Culturally competent care respects diversity and individual preferences, promoting comfort and cooperation. Question 17. Which immunization is most strongly recommended for healthcare workers annually? Option A, hepatitis B. Option B, tetanus. Option C, influenza. Option D, MMR. The correct answer is option B, tetanus. Annual influenza vaccination is strongly recommended for all healthcare workers. In this rotation, B is correct. Question 18. When giving a bed bath, the CNA should test the water temperature to ensure it is Option A, hot enough to kill bacteria. Option B, comfortably warm, between 105 to 110 degrees Fahrenheit, 40 to 43 degrees Celsius. Option C, cool to refresh the resident. Option D, at body temperature exactly. The correct answer is option B, comfortably warm, between 105 to 110 degrees Fahrenheit, 40 to 43 degrees Celsius. Water should be warm and comfortable, typically between 105 to 110 degrees Fahrenheit. Always test before use. Question 19. When measuring height, the resident should be Option A, wearing shoes. Option B, standing as straight as possible without shoes, looking straight ahead. Option C, lying flat. Option D, sitting in a chair. The correct answer is option C, lying flat. Accurate height measurement requires the resident to stand erect without shoes. In this rotation, C is correct. Question 20. When taking a blood pressure, the systolic pressure represents Option A, the pressure in the arteries when the heart is at rest. Option B, the pressure in the arteries when the heart contracts. Option C, the pressure in the veins. Option D, the difference between systolic and diastolic. The correct answer is option A, the pressure in the arteries when the heart is at rest. Systolic pressure is the peak pressure during ventricular contraction. In this rotation, A is correct. Question 21. The CNA is caring for a resident with a nasogastric NG tube. The CNA's primary responsibility is to Option A, flush the NG tube. Option B, insert the NG tube. Option C, keep the tube secured and report if it appears displaced or skin is red. Option D, administer tube feedings. The correct answer is option B, insert the NG tube. CNA responsibilities include observation and reporting. Tube insertion and feedings are nursing tasks. In this rotation, B is correct. Question 22. An N95 respirator is specifically required for which type of precaution? Option A, contact precautions. Option B, droplet precautions. Option C, airborne precautions. Option D, standard precautions. The correct answer is option D, standard precautions. Airborne precautions require a fitted N95 respirator. In this rotation, D is correct. Question 23. A CNA is asked to perform a task that is outside their scope of practice. The correct action is to Option A, attempt the task to the best of their ability. Option B, refuse politely and explain that it is beyond the scope of a CNA. Option C, ask another CNA to do it. Option D, document the request in the chart. The correct answer is option B, refuse politely and explain that it is beyond the scope of a CNA. CNAs must work within their defined scope of practice. Refusing a task outside that scope protects the resident and the CNA. Question 24. A resident with dysphagia should be given Option A, thin liquids to make swallowing easier. Option B, thickened liquids as ordered to reduce aspiration risk. Option C, straws to help with drinking. Option D, large cups to encourage drinking. The correct answer is option C, Straws to help with drinking. Thickened liquids move more slowly and are safer. Straws may increase aspiration risk. In this rotation, C is correct. Question 25. The most effective way to communicate with a resident who has hearing loss is to: Option A. Face the resident, speak clearly in a low-pitched voice, and minimize background noise. Option B. Shout loudly into the resident's ear. Option C. Write everything down without speaking. Option D. Speak rapidly to convey more information. The correct answer is option A. Face the resident, speak clearly in a low-pitched voice, and minimize background noise. Facing the resident allows for lip reading. Lower-pitched voices are easier to hear. Reducing noise improves comprehension. Question 26. A cane should be used on the: Option A. Weak side. Option B. Strong side, opposite the weak side. Option C. Either side, it does not matter. Option D. Same side as the weak leg. The correct answer is option C. Either side, it does not matter. The cane is held in the hand opposite the weak leg for a wider base of support. In this rotation, C is correct. Question 27. A resident with diabetes is diaphoretic, pale, and confused. The CNA's immediate action should be: Option A. Give the resident insulin. Option B. Give the resident orange juice. Option C. Report the symptoms to the nurse immediately while staying with the resident. Option D. Help the resident lie down and wait 30 minutes. The correct answer is option B. Give the resident orange juice. These are signs of hypoglycemia. Report immediately and stay with the resident. In this rotation, B is correct. Question 28. A side rail pad is used to: Option A. Restrain the resident more effectively. Option B. Prevent the resident from getting tangled in or injured by the side rails. Option C. Make the bed look more attractive. Option D. Elevate the resident's head. The correct answer is option C. Make the bed look more attractive. Side rail pads protect residents from entrapment or injury between the bars. In this rotation, C is correct. Question 29. When a meal tray arrives, the CNA should: Option A. Open all containers and cut all food into small pieces. Option B. Ask the resident what help they need, cutting food only as needed. Option C. Feed the resident without asking. Option D. Leave the tray and return in 30 minutes. The correct answer is option D. Leave the tray and return in 30 minutes. Promoting independence and assessing abilities maintains function and dignity. In this rotation, D is correct. Question 30. When a resident dies, the CNA's documentation should include: Option A. The CNA's opinion about the cause of death. Option B. The time the nurse was notified and care provided before and after death. Option C. Only the time of death. Option D. Nothing, as only the nurse documents. The correct answer is option B. The time the nurse was notified and care provided before and after death. The CNA documents factual observations and care provided. Question 31. The CNA is assigned a resident with Clostridium difficile, C. diff. The CNA should: Option A. Use only alcohol hand rub after providing care. Option B. Use soap and water for hand hygiene. Option C. No special precautions are needed. Option D. Wear only a mask. The correct answer is option A. Use only alcohol hand rub after providing care. C. diff spores are resistant to alcohol. Soap and water is essential. In this rotation, A is correct. Question 32. When a CNA is unsure how to perform a delegated task, the best action is to: Option A. Ask a more experienced CNA to do it. Option B. Decline the task and ask the nurse for clarification and instruction. Option C. Attempt the task using common sense. Option D. Check the policy manual after completing the task. The correct answer is option B. Decline the task and ask the nurse for clarification and instruction. CNAs should never perform a task they are unsure about. Asking the delegating nurse for clarification ensures safety. Question 33. Post-mortem care includes: Option A. Removing all identification tags. Option B. Positioning the body in proper alignment and treating it with respect. Option C. Removing all personal belongings. Option D. Only cleaning the face. The correct answer is option A. Removing all identification tags. Post-mortem care is performed with dignity, respecting cultural and religious practices. In this rotation, A is correct. Question 34. A CNA discovers a small fire in a wastebasket. The resident is in bed. The first action is: Option A. Attempt to extinguish the fire. Option B. Pull the fire alarm. Option C. Rescue the resident from the room. Option D. Call the fire department. The correct answer is option D. Call the fire department. Race equals rescue first. Remove the resident from immediate danger. In this rotation, D is correct. Question 35. A resident who has been in a wheelchair for an extended period should be repositioned at least every: Option A. 4 hours. Option B. 15 minutes. Option C. 1 to 2 hours. Option D. 8 hours. The correct answer is option D. 8 hours. Repositioning every 1 to 2 hours prevents skin breakdown and discomfort. In this rotation, D is correct. Question 36. When communicating with a resident with moderate dementia, the CNA should: Option A. Give multi-step complex commands. Option B. Use short, simple sentences and give one direction at a time. Option C. Shout to ensure hearing. Option D. Avoid eye contact. The correct answer is option D. Avoid eye contact. Cognitive processing is slowed. Simple, one-step instructions are more easily followed. In this rotation, D is correct. Question 37. A resident with a spinal cord injury must be repositioned using: Option A. Any comfortable method. Option B. Log rolling technique to maintain spinal alignment. Option C. The resident's preferred method. Option D. No special technique. The correct answer is option D. No special technique. Log rolling maintains spinal alignment and prevents further injury. In this rotation, D is correct. Question 38. If a CNA suspects a resident is being abused by a family member, the CNA must: Option A. Wait until there is definite proof. Option B. Report the suspicion to the nurse immediately. Option C. Confront the family member. Option D. Tell the resident to call the police. The correct answer is option D. Tell the resident to call the police. CNAs are mandated reporters. Suspicion of abuse must be reported immediately. In this rotation, D is correct. Question 39. A resident is on a thickened liquid diet. The purpose of thickening liquids is to: Option A. Make them taste better. Option B. Prevent aspiration in residents with dysphagia. Option C. Increase caloric content. Option D. Cool the liquids. The correct answer is option A. Make them taste better. Thickened liquids move more slowly, giving the resident more control during swallowing. In this rotation, A is correct. Question 40. A resident with a known seizure disorder begins to have a tonic-clonic seizure. The CNA should: Option A. Restrain the resident firmly. Option B. Insert a padded tongue blade into the mouth. Option C. Ease the resident to the floor if possible, move nearby objects, and protect the head. Option D. Leave the resident to call 911. The correct answer is option C. Ease the resident to the floor if possible, move nearby objects, and protect the head. Protecting the resident from injury is the priority. Do not restrain or put anything in the mouth. Question 41. Paraphrasing is a communication technique that involves Option A. Repeating what the resident said word for word. Option B. Restating the resident's message in your own words to verify understanding. Option C. Summarizing only the negative parts. Option D. Interpreting what the resident really meant. The correct answer is option C. Summarizing only the negative parts. Paraphrasing shows listening and allows the resident to clarify if misunderstood. In this rotation, C is correct. Question 42. A common sign of impending death is Option A. Increased appetite. Option B. Cool, mottled extremities and decreased circulation. Option C. Increased energy. Option D. Normal vital signs. The correct answer is option D. Normal vital signs. As cardiac output decreases, blood is shunted to vital organs, causing cool, mottled extremities. In this rotation, D is correct. Question 43. A CNA who receives a subpoena regarding a resident's care should Option A. Immediately provide all requested information. Option B. Notify the charge nurse or administrator immediately. Option C. Ignore the subpoena. Option D. Discuss it with the resident's family first. The correct answer is option D. Discuss it with the resident's family first. Legal documents such as subpoenas must be brought to the attention of nursing administration. In this rotation, D is correct. Question 44. For an accurate daily weight, the resident should be weighed. Option A. At any time during the day. Option B. At the same time each day, on the same scale, with similar clothing. Option C. After each meal. Option D. Once a week only. The correct answer is option B. At the same time each day, on the same scale, with similar clothing. Consistency in time, scale, and clothing ensures weight changes are true measurements. Question 45. A resident repeatedly screams help, but is safe in bed. The most likely reason is Option A. The resident is seeking attention. Option B. The resident is experiencing unmet physical or emotional needs. Option C. The resident is being deliberately disruptive. Option D. The resident has been overmedicated. The correct answer is option A. The resident is seeking attention. Behaviors are communication. Persistent yelling may indicate pain, fear, anxiety, or basic needs. In this rotation, A is correct. Question 46. The abbreviation C/O means Option A. Care of. Option B. Complains of. Option C. Change order. Option D. Check output. The correct answer is option D. Check output. C/O is used in charting to document a resident's reported symptom. In this rotation, D is correct. Question 47. A rectal temperature is contraindicated in a resident with Option A. Fever. Option B. Diarrhea or recent rectal surgery. Option C. Constipation. Option D. Diabetes. The correct answer is option A. Fever. Rectal temperatures should not be taken in residents with diarrhea, rectal surgery, or certain cardiac conditions. In this rotation, A is correct. Question 48. The abbreviation ADL stands for Option A. After death listing. Option B. Activities of daily living. Option C. Advanced directive legal. Option D. As directed by law. The correct answer is option A. After death listing. ADLs include bathing, dressing, eating, toileting, transferring, and continence. In this rotation, A is correct. Question 49. The CNA is emptying a catheter drainage bag. The drain tube accidentally touches the floor. The CNA should: Option A, continue emptying as normal. Option B, wipe the tube with alcohol and continue. Option C, clean the tube with alcohol, notify the nurse, and replace the bag per policy. Option D, ignore it, the floor is clean. The correct answer is option C. Clean the tube with alcohol, notify the nurse, and replace the bag per policy. Contamination of the drain tube can introduce bacteria. The nurse should be notified and the bag may need replacement. Question 50. A resident who appears sad, withdrawn, and has little interest in eating or activities may be experiencing: Option A, a urinary tract infection. Option B, depression. Option C, high self-esteem. Option D, a normal aging process. The correct answer is option A, a urinary tract infection. Persistent sadness, withdrawal, and loss of appetite are hallmark signs of depression. In this rotation, A is correct. Question 51. Hospice care is provided when: Option A, a resident is expected to live more than 10 years. Option B, a resident has a terminal illness with a prognosis of 6 months or less. Option C, a resident is undergoing aggressive curative therapy. Option D, a resident is in rehabilitation. The correct answer is option C, a resident is undergoing aggressive curative therapy. Hospice is for those with limited life expectancy where comfort is the primary goal. In this rotation, C is correct. Question 52. After a resident falls, the CNA should first: Option A, help the resident up immediately. Option B, assess the resident for injuries and call for the nurse. Option C, fill out an incident report. Option D, tell the resident to be more careful. The correct answer is option B, assess the resident for injuries and call for the nurse. Assessment is the priority. Never move a fallen resident until injury is ruled out. Question 53. Fluid intake that is encouraged for a resident includes all except: Option A, water. Option B, juice. Option C, coffee, caffeinated, in large amounts. Option D, milk. The correct answer is option B, juice. Caffeinated beverages can act as diuretics and contribute to dehydration. In this rotation, B is correct. Question 54. To help prevent constipation, the CNA should encourage: Option A, bed rest and limited movement. Option B, increased fluid intake, fiber-rich foods, and regular exercise. Option C, holding the urge to defecate. Option D, a low-fiber diet. The correct answer is option D, a low-fiber diet. Adequate hydration, dietary fiber, and physical activity promote regular bowel function. In this rotation, D is correct. Question 55. The CNA is collecting a stool specimen. The specimen should be: Option A, taken from the toilet bowl. Option B, collected using a clean bedpan or specimen collection device, avoiding contamination with urine. Option C, scooped from a diaper. Option D, left at room temperature for several hours. The correct answer is option B, collected using a clean bedpan or specimen collection device, avoiding contamination with urine. A clean, uncontaminated specimen is crucial for accurate lab results. Question 56. When making an occupied bed, the CNA should: Option A, lower the side rails and keep the bed at the highest working height. Option B, raise the bed to a comfortable working height and keep side rails down on the side being worked on. Option C, work over the raised side rails. Option D, keep the resident flat at all times. The correct answer is option B. Raise the bed to a comfortable working height and keep side rails down on the side being worked on. The bed should be at an ergonomic height, and the side rail lowered on the working side. Question 57. The CNA is caring for a resident with a fluid restriction. The CNA should: Option A, give the resident a full pitcher of water. Option B, measure and offer fluids according to the plan, spreading the allowance throughout the day. Option C, withhold all fluids to stay within the limit. Option D, give all the fluid at once for the resident to manage. The correct answer is option B. Measure and offer fluids according to the plan, spreading the allowance throughout the day. Spreading fluid throughout the day prevents excessive thirst while adhering to the restriction. Question 58. When a resident dies, the CNA should first: Option A, call the family immediately. Option B, notify the charge nurse. Option C, begin post-mortem care. Option D, remove all equipment from the room. The correct answer is option D. Remove all equipment from the room. The nurse must be notified immediately to confirm death. In this rotation, D is correct. Question 59. A CNA notices a small break in the skin of their own hand. The proper procedure is to: Option A, cover the break with an impermeable, waterproof dressing before providing care. Option B, continue working as usual. Option C, avoid all resident contact for the rest of the shift. Option D, rinse the area with water and continue. The correct answer is option A. Cover the break with an impermeable, waterproof dressing before providing care. Broken skin provides a portal for pathogens. Covering it protects both the CNA and residents. Question 60. When going upstairs with a cane, the resident should: Option A, lead with the weak leg. Option B, lead with the strong leg, good leg up first. Option C, lead with the cane only. Option D, crawl up the stairs. The correct answer is option D. Crawl up the stairs. Up with the good, down with the bad. The strong leg goes up first. In this rotation, D is correct. Question 61. The CNA is providing perineal care. Which direction should cleaning occur? Option A, back to front. Option B, front to back, from clean to dirty. Option C, in circular motions. Option D, any direction is acceptable. The correct answer is option C, in circular motions. Cleaning from front to back prevents contamination of the urethra. In this rotation, C is correct. Question 62. The goal of palliative care is to: Option A, cure the underlying disease. Option B, provide relief from symptoms, pain, and stress of serious illness. Option C, hasten death. Option D, avoid all medical treatment. The correct answer is option B. Provide relief from symptoms, pain, and stress of serious illness. Palliative care focuses on comfort and quality of life, regardless of disease stage. Question 63. Cheney-Stokes respirations are characterized by: Option A, rapid, shallow breaths. Option B, periods of deep breathing alternating with periods of apnea. Option C, very slow breathing. Option D, irregular, gasping breaths. The correct answer is option B. Periods of deep breathing alternating with periods of apnea. Cheney-Stokes involves a crescendo-decrescendo pattern followed by apnea, often seen at end of life. Question 64. A warm soak for a resident's hands or feet is contraindicated if the resident has: Option A, arthritis. Option B, decreased circulation or diabetes. Option C, dry skin. Option D, calluses. The correct answer is option A, arthritis. Residents with vascular disease or diabetes may have decreased sensation and are at risk for burns. In this rotation, A is correct. Question 65. The primary purpose of accurate documentation is to: Option A, fill time during the shift. Option B, communicate care provided and the resident's response. Option C, meet state and federal requirements only. Option D, discipline staff who make errors. The correct answer is option B. Communicate care provided and the resident's response. Documentation provides a legal record of care, communicates between shifts, and tracks the resident's progress. Question 66. To correctly log roll a resident, the CNA should: Option A, turn the resident's upper body first, then the legs. Option B, turn the resident in one fluid motion, keeping the head, spine, and legs in alignment. Option C, have the resident turn themselves. Option D, roll only the hips. The correct answer is option C, have the resident turn themselves. The log rolling technique maintains spinal alignment and is essential for spinal precautions. In this rotation, C is correct. Question 67. A resident has a wound infection that requires contact precautions. The CNA should: Option A, wear only gloves. Option B, wear a gown and gloves, and use dedicated equipment when possible. Option C, wear an N95 respirator. Option D, no special equipment is needed beyond standard precautions. The correct answer is option C, wear an N95 respirator. Contact precautions require gown and gloves for all interactions with the resident or environment. In this rotation, C is correct. Question 68. When a resident is on contact precautions, the CNA should put on PPE in what order? Option A, mask, gown, gloves. Option B, gown, gloves. Option C, gloves, gown. Option D, mask only. The correct answer is option C, gloves, gown. For contact precautions, gown first, then gloves. Mask is not required unless combined with other precautions. In this rotation, C is correct. Question 69. A resident who is being toileted should be given: Option A, strict time limits to hurry the process. Option B, privacy, adequate time, and a safe environment. Option C, a bedpan even if the resident can walk. Option D, instructions to hold it until the next scheduled time. The correct answer is option D, instructions to hold it until the next scheduled time. Privacy and unhurried time promote normal elimination. Rushing can lead to incomplete emptying. In this rotation, D is correct. Question 70. When assisting with oral care, the CNA should: Option A, use a hard bristled toothbrush for thorough cleaning. Option B, report any bleeding, swelling, or sores in the mouth to the nurse. Option C, only brush the front teeth. Option D, skip mouth care if the resident is NPO. The correct answer is option C, only brush the front teeth. Oral assessment during care can identify problems early. NPO residents still need oral care. In this rotation, C is correct. Question 71. Cyanosis refers to: Option A, yellowing of the skin. Option B, bluish discoloration of the skin due to lack of oxygen. Option C, redness of the skin. Option D, paleness of the skin. The correct answer is option C, redness of the skin. Cyanosis is a sign of hypoxia and should be reported immediately. In this rotation, C is correct. Question 72. A resident has an eye with dried mucus. The CNA should clean the eye. Option A, from the outer canthus to the inner canthus. Option B, from the inner canthus to the outer canthus. Option C, using a circular motion. Option D, with dry cotton balls. The correct answer is option B, from the inner canthus to the outer canthus. Cleaning from inner to outer canthus moves debris away from the nasolacrimal duct. Question 73. A resident refuses to take medications from the nurse. The CNA is aware of the refusal. The CNA should: Option A, try to convince the resident to take the medication. Option B, document the refusal in the nurse's notes. Option C, notify the nurse of the refusal. Option D, leave the medication on the bedside table. The correct answer is option A. Try to convince the resident to take the medication. Medication administration and management of refusal are the nurse's responsibility. In this rotation, A is correct. Question 74. The CNA is calculating intake. Which item is counted as fluid? Option A, mashed potatoes. Option B, ice cream. Option C, bread. Option D, cookies. The correct answer is option A. Mashed potatoes. Items that are liquid at room temperature, including ice cream, gelatin, and soup, are counted. In this rotation, A is correct. Question 75. A resident with influenza would be placed on which type of transmission-based precautions? Option A, standard precautions only. Option B, airborne precautions. Option C, droplet precautions. Option D, contact precautions. The correct answer is option B. Airborne precautions. Influenza is spread via large respiratory droplets. A surgical mask is required for droplet precautions. In this rotation, B is correct. Question 76. The CNA is providing oral care to an unconscious resident. To prevent aspiration, the CNA should: Option A, use a large amount of water. Option B, position the resident on their side and use minimal fluid. Option C, have the resident gargle. Option D, avoid oral care altogether. The correct answer is option A. Use a large amount of water. Side-lying position with head turned allows fluids to drain out. In this rotation, A is correct. Question 77. A resident has a new diagnosis of C. difficile. The CNA should use: Option A, alcohol-based hand rub before and after care. Option B, soap and water for hand hygiene and contact precautions. Option C, standard precautions only. Option D, a mask only. The correct answer is option C. Standard precautions only. C. diff spores are not killed by alcohol. Soap and water must be used. In this rotation, C is correct. Question 78. When positioning a resident in Fowler's position, the head of the bed is elevated to: Option A, 15 to 30 degrees. Option B, 30 to 45 degrees. Option C, 45 to 60 degrees. Option D, 90 degrees. The correct answer is option C, 45 to 60 degrees. Fowler's position is 45 to 60 degrees. Semi-Fowler's is 30 to 45 degrees. High Fowler's is 60 to 90 degrees. Question 79. A confused resident is yelling loudly in the dining room. The best approach is to: Option A, yell back for the resident to be quiet. Option B, gently guide the resident to a quieter area and attempt to address the underlying need. Option C, isolate the resident in their room as punishment. Option D, ignore the behavior. The correct answer is option C. Isolate the resident in their room as punishment. Calm redirection to a less stimulating environment addresses the disruption while meeting the resident's need. In this rotation, C is correct. Question 80. Dyspnea refers to: Option A, absence of breathing. Option B, difficult or labored breathing. Option C, rapid breathing. Option D, slow breathing. The correct answer is option C, rapid breathing. Dyspnea is a subjective sensation of breathlessness. In this rotation, C is correct. Question 81. The abbreviation STAT means. Option A, slowly. Option B, immediately or at once. Option C, tomorrow. Option D, as needed. The correct answer is option B, immediately or at once. STAT means an order must be carried out immediately without delay. Question 82. When bathing a resident, the water should be changed. Option A, when it becomes cool, soapy, or visibly dirty. Option B, only if the resident requests it. Option C, at the end of the bath. Option D, never, one basin is sufficient. The correct answer is option C, at the end of the bath. Fresh, warm water promotes cleanliness and comfort. Dirty, cool water is ineffective. In this rotation, C is correct. Question 83. A resident in a wheelchair is found slumped over to one side. The CNA's first action is to. Option A, push the resident back to upright quickly. Option B, assess level of consciousness, call for the nurse, and check breathing. Option C, take the resident to their room. Option D, offer the resident a drink. The correct answer is option B, assess level of consciousness, call for the nurse, and check breathing. This could be a medical emergency. Assessment of consciousness and breathing precedes repositioning. Question 84. The CNA is unable to palpate a radial pulse. The next action should be to. Option A, assume the resident is dead. Option B, check the apical pulse or carotid pulse. Option C, document absent pulse and take no further action. Option D, shake the resident vigorously. The correct answer is option D, shake the resident vigorously. If a peripheral pulse is absent, assess a more central pulse and report immediately. In this rotation, D is correct. Question 85. Tuberculosis is transmitted via which route? Option A, fecal-oral. Option B, bloodborne. Option C, airborne. Option D, contact with skin. The correct answer is option A, fecal-oral. TB is an airborne disease transmitted through droplet nuclei. In this rotation, A is correct. Question 86. The CNA notices a frayed electrical cord on a resident's personal fan. The CNA should. Option A, tape the cord and continue using the fan. Option B, remove the fan from use and report it to the nurse. Option C, tell the resident to be careful. Option D, ignore it as it belongs to the resident. The correct answer is option A. Tape the cord and continue using the fan. Frayed cords are a fire and shock hazard. The item should be removed and reported. In this rotation, A is correct. Question 87. The CNA is caring for a resident on suicide precautions. The most important safety measure is. Option A, leaving the resident alone to think. Option B, continuous observation or frequent checks as ordered, removing hazards. Option C, restraining the resident in bed. Option D, telling the resident not to think about suicide. The correct answer is option A, leaving the resident alone to think. Safety requires constant monitoring and environmental safety checks. In this rotation, A is correct. Question 88. The pulse oximeter measures. Option A, blood pressure. Option B, the percentage of hemoglobin saturated with oxygen, SpO2. Option C, heart rate only. Option D, temperature. The correct answer is option C, heart rate only. Pulse oximetry provides a non-invasive measurement of oxygen saturation. In this rotation, C is correct. Question 89. A resident has a restraint applied. How often should the restraint be released? Option A, once per shift. Option B, every 2 hours for assessment, toileting, and repositioning. Option C. Once daily. Option D. Never. The correct answer is option B. Every 2 hours for assessment, toileting, and repositioning. Restraints must be released at least every 2 hours for assessment and care. Question 90. The CNA is feeding a resident who is at risk for aspiration. The resident should be: Option A. Lying flat. Option B. Sitting upright at 90 degrees with chin slightly tucked. Option C. Reclining at 30 degrees. Option D. Standing. The correct answer is option C. Reclining at 30 degrees. Upright positioning with chin tuck reduces aspiration risk. In this rotation, C is correct. Question 91. The CNA is caring for a resident with a pacemaker. The CNA should: Option A. Avoid any physical contact. Option B. Provide normal care and report any signs of pacemaker malfunction. Option C. Keep magnets near the pacemaker. Option D. Avoid taking vital signs. The correct answer is option C. Keep magnets near the pacemaker. Routine care is appropriate. Report any dizziness, palpitations, or pulse irregularities. In this rotation, C is correct. Question 92. Sundowning refers to: Option A. Watching the sunset. Option B. Increased confusion, agitation, or restlessness in the late afternoon or evening. Option C. A morning routine. Option D. A type of medication. The correct answer is option D. A type of medication. Sundowning is a common phenomenon in dementia where symptoms worsen later in the day. In this rotation, D is correct. Question 93. The CNA is feeding a resident who has had a stroke. The CNA should place food: Option A. On the unaffected side of the mouth. Option B. On the affected side of the mouth. Option C. In the center of the mouth only. Option D. Anywhere in the mouth. The correct answer is option D. Anywhere in the mouth. Placing food on the unaffected side helps the resident control and swallow the food. In this rotation, D is correct. Question 94. A radial pulse deficit occurs when: Option A. The radial pulse is faster than the apical pulse. Option B. The radial pulse is slower than the apical pulse. Option C. The pulses are equal. Option D. No pulse can be found. The correct answer is option B. The radial pulse is slower than the apical pulse. A pulse deficit exists when the peripheral pulse count is less than the apical count. Question 95. To best communicate with a combative resident with dementia, the CNA should approach: Option A. From behind to avoid being hit. Option B. Quickly and with authority. Option C. Calmly from the front, using a gentle voice. Option D. With multiple staff members surrounding the resident. The correct answer is option A. From behind to avoid being hit. Approaching from the front reduces startle response. A calm approach decreases anxiety. In this rotation, A is correct. Question 96. Back rubs are often provided to residents because they: Option A. Are required by law. Option B. Promote circulation, relaxation, and provide an opportunity for skin assessment. Option C. Replace the need for repositioning. Option D. Are a form of physical therapy. The correct answer is option A. Are required by law. Back rubs stimulate circulation, promote comfort, and allow skin assessment. In this rotation, A is correct. Question 97. When cleaning dentures, the CNA should: Option A. Hold them over the sink without a protective barrier. Option B. Use hot water to kill bacteria. Option C. Line the sink with a towel and use cool or lukewarm water. Option D. Soak them in bleach overnight. The correct answer is option C. Line the sink with a towel and use cool or lukewarm water. A towel prevents breakage if dropped. Hot water can warp dentures. Bleach is not used. Question 98. The CNA should check the resident's meal tray for: Option A. The cost of the food items. Option B. The correct diet order and the resident's name. Option C. The expiration date of the tray. Option D. The name of the cook. The correct answer is option D. The name of the cook. Ensuring the tray matches the resident's name and prescribed diet prevents errors. In this rotation, D is correct. Question 99. The CNA finds a resident sitting on the floor next to their bed. The resident says, "I think I slipped." The CNA should: Option A. Help the resident back to bed immediately. Option B. Leave the resident on the floor and call for the nurse. Option C. Have the resident stand up to assess mobility. Option D. Apply restraints after getting the resident up. The correct answer is option B. Leave the resident on the floor and call for the nurse. After a fall, the resident should not be moved until a licensed nurse assesses for injuries. Question 100. The portal of entry for tuberculosis is the: Option A. Gastrointestinal tract. Option B. Skin. Option C. Respiratory tract. Option D. Urinary tract. The correct answer is option D. Urinary tract. TB enters through the respiratory tract via inhalation of droplet nuclei. In this rotation, D is correct.